You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello, everyone, and welcome back to Girls with Grafts. I am Rachel Kudlak. I'm one of the hosts of the show, and today, unfortunately, I will not be joined by my lovely co-host, Amber Wilcox. But per usual, we have a great guest lined up on the show today, and I'm so excited to get started. So without further ado, let me just give a quick thank you to today's podcast partner. And today's podcast is powered by the Burt Martin Foundation. The Burt Martin Foundation was established to assist those to help others and provide financial support for nonprofit organizations. And we are honored to have the Burt Martin Foundation as a long-standing Phoenix Society partner. And today on the podcast, I am welcoming Mikki Rothbauer. Mikki is a pediatric and adult burn and trauma psychotherapist with more than 21 years of experience working with survivors and their families in a level 1 trauma center. She is passionate about supporting people through recovery after traumatic injuries and works with both patients and their loved ones from the early days after injury through lifelong healing. Mikki uses cognitive behavioral strategies to help address stress and PTSD, and her work also focuses on grief, body image, cosmetic differences, survivor's guilt, and work-related injuries. She facilitates burn support groups, coordinates her center's Phoenix SOAR peer support program, and has a special interest in body image and sexuality during recovery. Mikki also has published articles and chapters on trauma and burn recovery, and she considers it a privilege to walk alongside survivors on their healing journey. So thank you so much, Mikki, for joining me today.
Yeah, thank you for having me. Happy to be here.
Yeah. Well, I know I just read your bio and I gave a little bit about, how you're connected to the burn survivor community, but I'd love it if you could just share a little bit more about that and specifically like how you first got involved in the burn survivor community and burn care.
Yes, that's a very fun story. So I am one of the lucky ones that knew what I wanted to do in high school. And I told my high school friends, when I grow up, essentially, I want to work in a burn center. And I want to be a social worker or psychotherapist. And so I kind of worked my way into Regents Hospital in St. Paul during my graduate school training as an intern. And that was in early 2000s, and I've never left. So I was an intern on the burn center as a social worker, and then I worked in that role for about 7 years. And then my current position was created. So I see primarily burn patients and their families, but also do some trauma work. And so I've been in that role for many years as well. And so I really feel super fortunate that like my dream of my career is really my reality.
No, that's so amazing. Well, I definitely want to dive a little bit more, obviously, into just some of the emotional side of healing that comes with a burn injury. Our listeners certainly know that, but I guess from your perspective, what are some of the, most common like emotional responses that maybe you see initially in those early days of recovery?
I think, I often say the two hardest emotions a human can feel are the 2 G's, and those are guilt and grief. And why I think they're so challenging is because someone can't just say, stop, don't feel that way, or let's go keep you busy and you're going to no longer feel guilty or have grief. And I just think those 2 emotions are paramount at the beginning, middle, and kind of throughout the journey. I mean, I think the what ifs, the could have, should haves, I think often patients feel like they're a burden to their family or to their workplace, or, and then, the guilt piece, whether it be a parent of a burn survivor that feels like it is their duty to prevent anything for the rest of time for their children, to people that just, have done something the same way a million times, and this one time had a different outcome. I think, guilt and grief, and there's a lot of other emotions. I think there's gratitude too, which I think is, I'm always humbled by that. This week I had our support group, and there were 18 attendees, and the theme, I think the takeaway from the group was blessed. People felt blessed. And I just commented to the group that, and this was, patients that have been in the hospital 3 days, all the way patients that have been burned 35 years ago. But just the irony of like, you're sitting in a burn center conference room and the theme is blessings and gratitude of everything in their life. So I think that is, as a healthcare provider and a mental health professional, it's just so humbling that people in the midst of all of the hard feelings, which I think, like I said, I think two of the hardest ones are the guilt and grief. They also have blessings of like, these are the positive things that are happening in the midst of all of this awfulness.
Mm-hmm. Yeah. I resonate with this as a survivor, but we hear it all the time of, sometimes it's years and years later, but survivors will often say, like, obviously I don't wish this upon anyone else, but I wouldn't change it for the world, for myself and like what I went through. And it is like I believe that, but it's still always shocking when I hear others say that, because from, the outside point of view, yeah, no one wants a burn injury to happen. Of course they're going to happen. And yeah, that like feeling of gratitude and being blessed is very powerful in our community. That's for sure.
Yeah. Yes. And ironically, we had this exact discussion, and I think some people are like, well, I could never imagine feeling like I wouldn't change it. And then I just try to assure people that it's a journey. And even, there's no like, okay, once you get to the point that you can say, I wouldn't wish this on anyone, but I wouldn't change it. That is not like the measure of like, you've made it, you've gotten through your journey, because I think some never feel that way. I remember the first time a patient told me this was, over 20 years ago. And I was like, what? Like, you wouldn't change it? And now, like you said, I've probably heard it thousands of times now. And it is, I think it just speaks to the strength of the human spirit and the importance of community. I think community is so huge in recovery. So I'm really thankful when patients in those initial days and weeks are open to peer support, whether that be one-on-one with SOAR or coming to support group, or even just meeting with a mental health professional, because I think that vulnerability they feel early on is really intense and often can be the reason why they push those things away. Like, I can't take another thing. I don't want to deal with another thing. But when I use my little coercions to get people to come to group or to be open to a SOAR visit, I say, in all my years, I've never met someone that said, I really wished I wouldn't have gone to group, or I wish I wouldn't have had that peer support visit. I've never had someone say that. So it's a pretty good track record.
No, that's a great point. But I want to definitely dive a little bit more into that of, we do hear from, other Phoenix SOAR coordinators or volunteers that, like you said, the power of peer support, we know it from the other side, but it can be really difficult, especially in those early days and early recovery, to get a survivor to want to meet with a peer supporter or to go down to support group. So what other tips, other than that proven track record, which is a great point, but do you have any other advice for, maybe especially like burn care professionals who are trying to encourage their patients to get connected to peer support?
Yeah, I have a few one-liners that I use. And one of them is, for group, like, you might not need group, but group needs you. Because I think people feel like, well, if I say yes to going to group, that means that I'm saying I need a therapy group. And so I just really try to normalize it. Like, it's a supportive time together where everyone's, experiences are honored. You can say as little or as much as you would like. We just, some people will want to share a lot more. Sometimes I'll have a patient say, well, I just want to say my name. And then I'll say, well, is it okay then if I share a little bit about what happened to you? Oh, yeah. And I think part of that is I think to be in a group, it's really important to have some standards, and the standards are like your name and a little bit about your injury. You don't have to give details. You like I have a 3% burn and I had surgery, but I think there is there's some importance with having that shared experience. And if people are like, I don't want to share, then that can make people that are sharing feel a little, I don't know, like there's just a difference, an imbalance. So I really try to normalize it. I think another thing that has been incredibly helpful in the burn center regions where I work is my nursing team, and my ancillary team, the other, social workers and OTs. I have little like printouts the day of group to give to patients, but I've realized it definitely takes the whole team to be promoting these things. And group is one of them, and peer support is another. That everyone is invited, everyone should go. It's really great, and like building it up. And so a couple of years ago, I started to invite staff to attend groups so they could see what it's like. So they could also come back, at the bedside and talk to a patient. Like, I've been to group and it is great. I think that's been really effective. For peer support, I think there's very different ways you can invite people. And I think, like, for example, one way would be, say we have this peer support program and we have, burn survivors who've gone through this training and they can come back and talk to you. Would you like me to set that up? I think more than 50%, probably closer to like 80% of the patients would say, no, that's okay. Don't bother. It's okay. Which is why I don't use that version. I use the version of like, I know someone that is in our peer support program and I know they would just love to meet you. I know they have some availability, during your hospital stay. So would it be okay if I arrange something and I'll let you know when they can come? That's a very different, like, they want to meet you. This is a normal part of like our care that we provide here. And so, I think we probably average about 3 SOAR visits a week at our burn center. Wow. And I think it's in part because of my whole team, really seeing the value of it. And then I think the natural part that happens is then after that visit, the patient tells everybody that comes in their room how great it was or how great that SOAR visit was. So even if staff don't know necessarily the details or they haven't been to group, we do have a SOAR board where we have all of our SOAR volunteers and their story, for staff and for patients and families. And so I think that's helpful. But I feel like we've been, I've been doing this for 22 years and we've had the SOAR program since I started, and we've had a support group since I've started. And I often open my group with, it's one of my favorite parts of my whole career because you see the healing and you can see it happening like right in front of your eyes over the course of a couple hours of strangers giving just love and support, authentically. I think I had a patient once say to a new patient in the group, welcome to the family that you never wanted to be a part of, but now you can't imagine your life without it. So I think it can be really powerful. And I think promoting it within teams is important, but also just normalizing it as part of like a natural part of care. Because I don't think anybody wants to say, I need it. I need that. But if you phrase it like, we need you, like we need you at group.
I like that a lot. And I think too, when you're talking about like, oh, I have a peer supporter who may have who I know can come in during your stay, like that makes it feel, I think, a little more casual, which can be like helpful for survivors because, kind of going back to like grief, sometimes and oftentimes survivors are feeling that like loss of independence and loss of freedom during that initial stay or those initial days. And even now as an adult, sometimes I'm like, it's not as shameful to go get peer support or therapy or get help, but sometimes it feels nicer when it's more casual and it doesn't necessarily feel like you're going to like a peer support visit. I'm just meeting someone who's been through this before.
Yep. Yeah. And I think, I always keep in mind that when I'm meeting a patient in the hospital, it is the absolute most vulnerable position they can possibly be in. So yes, giving choice. Like, oh, they can come on this day or this day. Even those little things I think can help them have buy-in. So yeah, I really like am passionate about trying to get as many as possible visits and people to come to our group. We have 3 a month at our burn center, and they're really well attended. Mostly there's of course the times that we only get 6 or 7, but and I think the other thing that motivates me, and I know I can probably speak on behalf of my other mental health colleagues from all over the country and the world who do burn care, is when you go to a place like World Burn Congress and patient and survivor after family say that it was such a fundamental part of their journey. A positive piece was having that support. And so, every time I hear that, or I hear it, especially in large numbers at a place like World Burn, it just motivates me to be like, oh my gosh, we have to put time and energy into this. It is paramount, and it's really, really important.
Yes, for sure. For sure. Well, I know I've heard only great things about your work, especially with Phoenix SOAR. So just want to give you a quick, kudos and thank you for all the work that you do with that program as well.
Oh, thank you.
But I do want to dive a little bit more. I know we've been talking about peer support, but can you, I guess I want to dive into a little bit more of obviously like the PTSD and those triggers that survivors can have afterwards. I guess, what are some like signs or things you should look out for between I need to be going to support group versus maybe I need a little bit more dedicated care from someone like you, Mikki, or having more of that, I guess, I don't want to say like professional care, but I think you get what I'm going for.
Yeah. Oh, that's a really great question. And I think, I always I hear patients say like, is this normal? Like, should I be feeling this? And my response to that is like, what you're feeling is, if you're feeling it, then it's not abnormal, but let's talk about what that is. So it could be like I'm having really bad dreams, nightmares, but they're not about the injury. So it must not be related. And then I will say, actually, it is. Like our brain is our most complex organ of our body, and it is affected in the seconds or minutes or however long you've gone through the trauma. And so I think one part of it is like just assuring them that it's normal and that there is help. And I think regarding like what are the indicators, I think having repetitive thoughts about it. Now that is kind of a tricky concept, because you've just been, let's say, for example, you were in a house fire. Well, of course you're going to be thinking about what happened, and fill in house fire with any other burn injury. You're going to be thinking about it. And so people, like, oh my gosh, they need, they need all this train, they need all this therapy, or we need to like get them seen by a psychiatrist. And yes, maybe at some point, but it's also like, I think some of that acute stuff is wrapped up in the grief. And, but I think indicators of like, okay, we probably need to get a psychologist or psychotherapist or some, even, a clinical social worker, intrusive thoughts. Like you can't really think through a sentence because you either have like images that you're thinking of, or you're like, why did I do that? I was like, that was so dumb of me. So I think intrusive thoughts, I think, are one of them. I think nightmares for sure. I think inability to eat or sleep. I mean, just kind of that like heightened anxiety. I also get nervous for patients when, this is an ironic thing is, for example, a patient has a pretty significant injury, and they're like, I come to meet them and everything's great. I have this great family. I have nothing. It could have been worse. I have nothing to worry about. Like, it's going to be fine. And then that's the next day and the next day and the next day. And there's like no like evidence of sadness or grief or, even just any type of emotional pain, I worry about those patients a lot, because I think like underneath that maybe resilience is really pain. And let's also tap into that. Not that I go looking for it, but I think if someone realistically has a lot of really awful things happening to them, and it is as if they're like, going to the mall and they're not like having any emotional reaction, I worry about those folks as well. I think there is, on our center, we have this kind of like, the patient, if a patient's crying, oh my gosh, they might need mental health. And I think, yes, I think they could use support, but crying is also a very healthy coping mechanism when you're something really hard and you're grieving and you're sad. And so I think it's a balance of like supporting them, really digging into like, okay, so where are these tears coming from? But also normalizing that like you're going through something really, really hard. I think patients that have great support systems, I mean, I know this is probably obvious, but just do a lot better. And I think sometimes as a mental health professional, I can do really great work for the patient via their family and via their support system of like, these are the things, these are the ways that you can support your loved one. Like, for example, I've heard this more times than I would like, which I completely understand why people say this, but like, it'll be someone with a large burn and everyone in their family is like, oh, we're just so glad it wasn't their face. So glad it was, and while I appreciate that comes from a really good place, it comes from love, it comes, then those patients will say to me privately, like, so I guess it wasn't my face, so it doesn't matter. I should just cover up my burns because it'll make everybody else around me feel better. And so I think there's the support that we give. There's the evaluation we do of like, okay, yep, this patient's really struggling. They might need a psychiatry referral, or they might need something more than just that, bedside support. And then also I think there's the extension of like, how do we help educate their loved ones to really support them and part of what I often say is, you don't know what you don't know. You're like, you're saying this from the deepest love and concern. But it's they see it, their burn, or they have the experience and the memory of sustaining their burn. And so I think there's a time and a place to say that to families so they don't feel like what they're doing is causing harm. But I think utilizing their support system to also, I'll often say to family members, especially if a patient comes in and they're intubated or they're just really, they're sick. I'll say to family members, like, I can't wait to get to know your loved one, but you know them best. And so please reach out if you're seeing something, because you're going to see things for myself or my burn team. And that really has been also super helpful for me of like, they're noticing things that maybe to us, we as professionals are like, oh, well, that's normal. And then they're like, no, like
not for them.
This is not normal for them. This is like way different than how we know them. So that can be kind of, utilizing the observers as well. I'd also like say I give a shout out to my night nurses who get, they spend a lot of more quiet time with patients. So I really appreciate when they'll send me a message saying, I went to check in with the patient and 2 hours later, I've realized, they're feeling really sad about X, which that never came up during my visit with them. Whatever. So I think back to the word community, I think the community includes everybody. So there's, the medical professionals, the support systems, and the patient indicating like they're okay or they're not okay. A very long answer.
No, that was great. And I wanted to pull out something you said earlier about sometimes like under the resilience, there's more layers there that need to, maybe be talked about or, let out. And I can relate to that, and I'm sure many survivors can, and we all know it's a lifelong journey, and sometimes you get 10 steps ahead, and then some days you take a few steps back, and that's just part of healing. But it's, yeah, like you have on like not a mask of resilience, but sometimes we get into like we are so resilient, but then maybe we're using that as a way to cover up some other things that are also going on, but we want to have it. And we are, like I said, we are resilient, but sometimes like you said, that could almost be like a mask of some other feelings that are deeper down.
Yeah. I mean, I have a kind of a sweet, but I mean, sad, but it came, she taught me a lot. This was a patient who had a very significant injury and had an amazing, she was like the definition of resilient. And she got the nickname Superwoman, which is like very sweet. Mm-hmm. Her like, yeah, I think she's, she was at the time in her 50s. And so it was just, and people called her that, and she took pride in that. And then Superwoman doesn't have a bad day. Superwoman doesn't feel sad. Superwoman doesn't get discouraged. And so she, I think about a year and a half after her discharge, she completely fell apart. And admitted, like, I'm not living up to what people, how they see me. And if I couldn't tell anybody because I've been hurting, but everywhere I go, people they just kind of, in her perception was that they expected her to always be that way. And if she got frustrated or she got sad or, became angry, that then she was letting everybody down because it was this like almost self-fulfilled prophecy of like, I have to be perfect because if I'm not perfect, then I'm not worthy and I'm not a good survivor. So she taught me a lot about just recognizing when someone's like, I'm doing great. Like I met with a patient yesterday. I'm doing great. Everything's good. And I think authentically he was doing well. And I just always, in all of those situations, say, and you know what, part of doing well and doing great is having moments or pockets of your day that maybe don't feel great. And that is okay. Like, it is okay. It's more than okay to have moments of like, why did that happen to me? This stinks or sucks. But part of doing great and getting through this is acknowledging that there are moments that aren't great, and that's okay. That's part of it. Like healing from this, from an emotional standpoint, is not linear. It's not like, and there's not you pass, here's the finish line and you're all good to go. Like this is the sign that you're completely through it. Because I've heard so many patients do really well, and they do really well. And then maybe it's the anniversary, or maybe it's just something that's a different type of, maybe it's a small trauma in their life, but then it brings up this other stuff. And they're like, but wait, I was doing so well. And now I'm back to square one. And I gently say, no, you're not. Like, this is the journey. And you're going to use all of those things that you learned to get through those early days of your trauma and your recovery to get through this. But this isn't, you're back to square one. It might feel like that, but in reality, you're not there. You're farther ahead than that. And that's often where I'll also kind of introduce the concept of like grief and trauma are cumulative. So, someone has a burn injury, and then 3 years later, something happens in their life. It could be that their grandma died, and they're starting to really think a lot about their burn and this, and like, but why these things are not related. But our brain remembers trauma, and grief and trauma are like evil twin sisters. Like, they are just where one is, the other one is. And so I think like just recognizing that they're not going crazy. This is just this is the way that our brain stores trauma and stores grief. And it doesn't mean that every time is going to be so much worse than the last time. I think acknowledging that it's there, and that let's tap into the tools and the resources that are helpful to you individually.
Yeah. And I think that's, because I totally do that too, of like, when your example was perfect, because last year my grandfather and grandmother died, and that they were a big part of my healing journey, and it did bring back so many feelings and emotions. But that's when it's like the helpful reminder of, it's not a linear, straightforward healing journey. It is, like I said, some days you go forward, some days you go back. And you have to, that's why it is so important to learn kind of how to manage it and what support you need and how to best support yourself and others, because trauma is always going to continue to happen, unfortunately, whether it's small or whether it's big.
Yeah. I when you shared that, it makes me think, in my outpatient practice, I often hear patients say, like, what's wrong with me, Mikki? Like, when I was in the hospital, I didn't feel like this sadness. I didn't feel this like heaviness. And like, what's wrong with me? And it just hurts my heart because I think like there's nothing wrong with you. But like when you're in the hospital, everything is fresh and you're in this little bubble. You're in this bubble of like, you're not going to the grocery store and you're not having to maybe have people stare, because everywhere you go in the hospital, it's pretty safe, especially on the burn unit. That you're not having to deal with some of those kind of emotional triggers that can be hard. And just validating that it is, I think acutely is hard for sure. But what I've learned from the survivors I've worked with is that there are different pieces of the hard. And the physical part is really hard acutely. And the emotional is also hard, but I think the emotional gets harder when you leave that acute setting and you're like figuring out what is your new normal and where do I fit into this world within my family, within my, all I can think about is my burn injury, but I'm out with my friends and they want to talk about, the recent movie. And I think like, that is the stupidest thing. Like, I don't care about the movie. Like, and I think just validating that it will get better. But there's nothing wrong with you if you are feeling like, well, I was feeling so much better in the hospital. And I think part of that is because in the hospital, we have this buffer around you that you just have all this protection. I think a lot of adults will say, yeah, I guess when I think about it, like I didn't have to cook, I didn't have to clean, I didn't have to support my family, whatever that looks like, getting kids from school, like that was all being done for me. And then I think the other piece is like, life is always moving on. And so like when you're in the hospital, everyone's coming to see you, you have cards coming, potentially, I think and then you go home and people are on to the next thing, which in some ways is a blessing because that means you're doing well and you don't maybe need that level of support, but also super frustrating and sad. Like, wait, like, no, I haven't had anybody check in with me for 3 weeks. What about that friend that was coming by every other day to see me at the hospital? Or, I would get 20 text messages a day in the hospital and I've been home for 2 weeks and I haven't even got 20 texts. So I think acknowledging that they're not alone in that, and that is a very normal phenomena that happens. And while it is very personal, I think it's to be reminded that you're getting less of those check-ins because you're in a better place medically, but emotionally now I think it's the time that if you need support, like let's practice what that would look like. What would that look like for you to reach out to one of those awesome supporters when you were in the hospital and say, I would just really like to grab a cup of coffee, or is there any chance we can have a phone date here in the next week? And I go to my line of, when you ask people for help, it feels really good to be the helper. So when you ask someone for help, you're giving them the gift of feeling needed and wanted, and do it and do it over and over.
I need to remember that because I am awful at asking for help. So I will keep that in mind. It's
help people. Help people by, and I often, like, I say this and, I'm like, when someone's having a bad day, if you buy them a cup of coffee, it's the best, well, now probably $7 you would spend, because like it's more than just the coffee. It's more than just the text message. It's more than just the let's have a phone date, because it's so much bigger than that. But I think I try to remind my survivors that people, they also don't know what they don't know. They don't know what you need. And and I think we are all very egotistical. We are all very like what we're doing. And I think so many people are like, I don't want to bother them. They just got home. Yep. They've been home for a while. I haven't heard from them. So everything's going well. So I think I try to put a little bit more emphasis on like, what do you need? And let's help you get what you need, even if it's you reaching out and asking for what you need, because people don't know what you need.
Yep. Exactly.
As evidenced by like what you need today might be different than what you need 3 days from now. And for surely it's going to be different what you're going to need 3 weeks from now. So.
For sure. And no one's a mind reader. I also try to remind myself of that, of no one knows. Unless you tell someone what you need or how you're feeling, they're not going to be able to read your mind for you.
Nope. And I think we do like, what would I, in that situation, what would I do? And I gently remind people, like, I don't think we could ever really know what it would be like to be in the position of a burn survivor, and all of the things that involve that. Because I feel like burns are very different than other types of trauma. So all the more reason why people don't know how they would handle it, even if like, oh, if I was in that situation, this is what I think I would need. So yeah, I really try to empower people to use their voice, or even lean into their family to be like, hey, I'm feeling really lonely. Can you just invite some friends over for dinner on Friday? Or, like also using your support system to ask for that support if you can't yourself.
Mm-hmm. Definitely. Well, one thing you touched on just slightly, and I do want to shift gears a tiny bit, is because I know you've done a lot of work with body image and confidence and, that part of the healing after a burn injury. So I don't know if you just kind of want to talk a little bit more about your work there, or maybe, some of the struggles that you see with a lot of survivors, especially when it comes to body image and even just self-love again after an injury.
Yeah. Oh gosh, for sure. I mean, we could probably have a whole another 2 hours on this, but I think, there's stages. I think initially it's like, I want to go back to what I was, and the gentle reminder of like, none of us are ever who we were yesterday. We are today who we are based on all the yesterdays of our entire life. And so really just giving them space to grieve the difference, the change, because if you have a 1% burn, it's still, your body's different. And I think really just normalizing that if you have an abdomen burn, that doesn't give you less permission to feel sad than someone who has a hand burn that's visible, or a facial burn. Because I think there's a lot of that. Like, patients will say they come to group and maybe everyone else has a visible burn, and they're like, I don't really belong here because they have it so much worse than me. I shouldn't even feel bad about the fact that I can cover up my burn. And then I just, that is like such a hard thing. I'm like, because no, it's your body, and you see your body every day, and you sleep in your body, literally in your own skin. And so how can we look at what the scar as symbolic of strength? Like, how do that automatic words that we use, like that, I'm ugly, I'm disgusting. I do this with my pediatric patients all the way up to my elderly patients of like, okay, so let's put some Post-it notes on your mirror that says something kind. And you can't help but read a Post-it note when you're washing your hands at the sink. And the more you use that positive language versus the self-deprecating language, the better you can start to feel. I really work with patients too on having that kind of mind, heart, body connection of like, this thing happened, this scar resembles pain. Absolutely. But it's not just pain that it resembles. It also resembles love that surrounded you as you recovered from it. It resembles strength of getting through it. A patient once shared with me that they had a lot of tattoos before their injury, and that, they everywhere. And I just made an observation, like, all of your tattoos tell a story. And I think a lot of people that get tattoos, it means something to them. whether they want people to ask about what it is or what it means or not, there is some meaning behind it. And so this survivor of mine said, I think like I'm gonna try to look at my tattoos as the story. And then I said, well, what about we look at your scar like a story, like one you didn't choose. And so I don't want to minimize that. Like a scar is very different than a tattoo. You didn't choose it. It was all of that. But I think it really resonates with a lot of people of like, I can choose how to look at this. And also just recognizing that even if you get to a place where you're like, yep, I can wear my scars proudly. It's also okay to have time when you're like, today's not one of those days, or this is not one of those moments. Like right now, I'm just irritated that I have to deal with this, or I have to deal with this modification I have to make. I think it's the balance of honoring the pain, but celebrating the joy and celebrating the progress and celebrating the healing journey. And I know I make that sound really like easy, and it is not at all. But, I think the other thing that happens in the hospital is touch can be not great. I think most of the time touch is painful. Touch is welcomed. So really working with a patient, and if they have a loved one, a partner, how do we change that touch being negative and painful and bad to like healing and natural and good? And I think that's where, body image and sexuality, I really talk about it a lot, because I think a lot of couples don't know what to do when they leave the hospital, because especially if one of the partner is the caregiver and the dressing changer and the, doing all the things that are not very intimate in a romantic way. But also recognizing that intimacy means a lot of different things. And I feel like it's part of my role to like figure out what that means to them and just say it, because I think patients feel like I can't ask my partner to do one more thing because they're doing all this. And yet the partner is just like yearning for the patient to say like, I want you to come lay in this bed with me, or I want you to rub my back, or I miss this part of our relationship. So I think it's important for healthcare professionals to bring it up, because the concept of like, well, they didn't bring it up, so it's not an issue, is just completely untrue. I think that most patients, even, and I'm kind of like leaning into more intimacy and sexuality now, but I think even those that are really open and have really healthy communication, this feels like different and hard for many of them, because it's like, how do I do that? And I think, that also kind of rolls into the body image of like, for adolescents, how do they, where are they at with how they see themselves? And I think there's the validation and the teaching again of their support system of like, it's loving, but it's not incredibly helpful to be like, don't feel that way. You look great to me. Like you shouldn't say that, because in my eyes, you haven't changed. I've had a lot of survivors say it's not super helpful to be like, it's what's on the inside that counts. That also comes from a really good place. I hear it a lot. But I think there are different ways to support people in that place of like, of course you feel like, because this is a big change, but you are still all of those things that you were, and now you're even more, because you have this lived experience that is going like, we're all, and then I think just naming like, I've seen you do this and this surprised me, or I'm inspired by you because of the way you said this or handled this. I think those things go a long way of like, we teach our siblings of our pediatric burn survivors, like how different it would be to hear, you're walking into, let's say, church and someone's staring at your little sister who has a burn scar, instead of, saying, take a picture, it lasts longer, or something really gruff, saying something like, my sister's so brave. I'm so proud to be her brother. I hope you have a good day. Like for the burn survivor, that goes a long way with everything, with confidence, with self-esteem, with body image, of like someone was staring at me and it was met with kindness and love. And I get to keep walking to wherever I'm going to and feeling really good about it. But the sibling or the parents even don't know how to say that unless we help guide them and we teach them that, from the beginning all the way through.
Yeah, no, that's such a good point that I love of, the classics, like take a photo, it'll last longer, but flipping that around and really empowering the survivor in your statement too that's such a good example that I hope that folks who are listening will save that for if they need it later on. It's so good. But when we're talking a little bit too about intimacy, especially, and going back to the hidden burn survivors, because we do hear that, and my scars aren't hidden, but I have friends whose are, and I hear them say, well, it's easier for me because I can hide it. But then I'm on the flip side of, but it's easier for me because mine are out in the open. I can't hide them. I can't avoid showing my scars. So when it comes to intimacy, for those who do have hidden scars, I guess it comes up a lot of, I want to start dating, but I don't know, when to bring up my scars. I don't know, once I am maybe more in a relationship, when to have maybe tougher conversations of being intimate with my scars and have certain feelings or whatever it may be. So I guess, what advice do you have for those with those hidden scars?
Yeah. Oh gosh, it's so dear to my heart, because I've had patients with visible scars say something like, I actually am thankful that I have visible scars because my pain is evident everywhere I go. And while sometimes that is unwelcomed because I have to deal with stares or all that, but people also can see my pain, and I sometimes get the benefit of the doubt, or I get kindness from strangers. So when I meet with folks that have hidden burns, I'll talk with them about, what's your comfort level with your scars? I mean, that is kind of step one of like, when you see yourself, how do you see yourself? And then I think it sounds so much more black and white than it really is. But I think your partner that maybe doesn't know just needs to be educated. Like, a burn scar can look really painful. And I've had a lot of couples say, like, I don't want to touch it. She says it doesn't hurt, but I don't want to hurt her. So just really, I think talking about your experience, I think I remind survivors that intimate conversations bring people together. And so being vulnerable during that intimate conversation about, like, this happened to me and this is where my scars are. And I feel super nervous about even talking about this, let alone having you see it. I think that's kind of step one. And then I think the next part is, like, this is what works for me. Like, I don't want you to touch it. Can we touch it right now? And this, like, when the TV's on and it's 2:00 in the afternoon on a Saturday, like, can I show it to you? I think, like, thinking about what, as a survivor, you want that, or what you think you could have that look like, with the reminder always that if this is a person that you're having a discussion with about this really vulnerable, intimate thing, my assumption is that they care about you and they don't want to hurt you, and they just really want to understand. And they won't understand unless you tell them, like, this is what I need. I'm not quite ready to show you, but I just want to tell you. Because sometimes it's always a process. It's a process of, like, okay, I'm starting to get comfortable with myself, and maybe enough that I want to be more intimate with someone physically. Okay, what does that look like? And it doesn't have to be like, okay, we're going to schedule it for Thursday night at 7 p.m. and this is going to happen. But like, maybe let's schedule a conversation during our next meetup of what this looks like. And I think also putting it out there that it changes, and like what you feel about a scar and about your piece and where you are sexually and in your sexuality, like, changes. And so it's an evolving thing. And, I remind patients in the more acute setting that, we are sexual beings. We were born as sexual beings. So it's a very normal part of life. And my providers at my hospital are really good. Like, I think if we have a patient that has a burn in, let's say, their groin area, I'm very thankful that we can talk about what medically, because there's the emotional part, but then there's like the medical physical part. Like sometimes patients won't want to ask the question, like, what does this mean? And how does this affect this part of my life? So I think for providers to be very intentional about not waiting for them to ask the question, but just treat it like this is what they need to know about, what the precautions they need to make or need to take. But also that touch is really good, but reminding ourselves that, like, for however long, for many survivors, touch has not been super good.
Yeah. What I think, there's two kind of key things I wanted to point out too, of, like you mentioned earlier and just now, just because a survivor or patient isn't bringing it up doesn't mean it's not an issue or a problem or a question that they have. So I think that's a valid point for not just the professionals, but also the survivors too. Like, just because maybe your medical professional or a caregiver is not asking doesn't mean that they don't care. It's not also on their mind. So I think that's such a good point. And then going back to, I think it kind of all circles around to like the importance of community and that power of peer support. And maybe if you are a couple who has questions about intimacy and finding, maybe it's another couple, a support group or caregiver to caregiver to have, like you said, oftentimes it's like, I don't want to hurt them. I don't want to make them uncomfortable. They're already going through a lot. But yeah, having that peer support to be like, well, how did you feel? Or how did you approach this conversation? Or how did you talk to someone about it? I think is so important, because we can sit on here and give so many tips, but it's also nice to, have just an honest conversation with someone who's done it in person or over the phone and feel supported that way. Someone that you trust too.
Yeah. Yeah. I mean, I often tell our SOAR volunteers, like, me saying the exact same thing that they're saying, what they say is more powerful, I think, because it's the lived shared experience of, I mean, I can be really supportive. But when it comes to something like this, I think having someone who's lived it, who's experienced it, and especially kind of to your point of, like, this is a couple that went through this awful thing. And here they are 6 years later, 10 years later, visiting me and my partner, saying that they've made it. They've gone on to have another child, like all the things that are real and very possible, but they don't think that's possible. And I can say that 100 times, but talking to someone across the room that has lived it, has experienced it, and can talk about how normal it is to feel however they're feeling in that moment. But it's not a permanent, it's that feeling isn't permanent.
Definitely. Well, Mikki, I know we are coming up on our time, and I do have two final questions for you. But before I ask you those, do you just have anything else you want to share with our listeners today?
Well, I think one of my other little kind of one-liners that I feel like can be helpful for survivors at any stage in their recovery is that a stare is an unasked question. I think many have probably heard that, but it's such a good reminder of, like, when you're in the receiving side of being stared at, it feels very invasive. It feels, I think people have used the word cruel, all of that, very valid. And it's really hard, but if we can, like, take a step back and think about when we've seen something that looks different, or we are, we're walking along and we hear a loud noise, we might try to figure it out. And so I think just reminding ourselves that I think people are curious, and when they're staring, they're just asking a question. And so seeing that possibly as an invitation to be like, looks like you have a question. And then if you're comfortable sharing your story, or my other thing is the universal language of kindness is a smile. And if you smile at someone, it's really hard not to smile back. And so if someone's staring at you, I think to break the stare, to smile, and you both walk away from that silent interaction feeling pretty good.
I love that. That's great advice. Well, like I mentioned, we do always ask our guests 2 final questions. So I'm going to ask Amber's for her today. Her question this season is, if this season of your life had a soundtrack or a song, what would it be?
I feel like it would be Stronger by, I can't remember if it's Miley Cyrus maybe, but I just listened to that this weekend, and it makes me think of just meeting obstacles with open mind and open eyes. An obstacle is a challenge, but if we can also see through that to see it as an opportunity to learn things about ourselves, to learn things about the people around us, and if we're open to it, then it can be a possibility. But also, like on the flip side of that, the song is also about some pain, and just that where there is love, there is pain, and there is pain because there was love.
Yep, exactly. Love that. And then it is time for our final question, which is our Phoenix Partner question today, sponsored by the Burt Martin Foundation. So their question is, what is one message you hope that sticks with our listeners today?
I think to remind yourself that healing is a journey and it's not a destination. And as you go through each parts of your journey, there's going to be some really high highs, and there's likely going to be some really low lows. And so appreciate kind of as much as you can both of those extremes, because they're temporary. You're going to get through it, and you're going to be able to learn and grow from both the highs and the lows.
I love that. I think that'll probably be our episode title. Healing is a journey, not a destination. And I think that's so powerful. It's a really good message. If someone only remembers one thing from this, that's definitely it. Well, Mikki, thank you so much for joining me today. This was amazing to have you on. We may have to have you back, because I know we touched the surface of a lot of different topics that I know we could have talked way longer about. So I so appreciate you taking the time and sharing your wisdom with us.
Well, thank you so much for having me. It's an honor. So thank you.
Awesome. Well, thank you. Have a good one.
Thank you. Bye-bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.